Thanks for joining me. I'm Professor Morie Gertz from the Mayo Clinic in Rochester, Minnesota, and I'd like to go over a little bit of the ABCs of amyloidosis. Most of the components of your body are completely biodegradable and recyclable. The nutrients that you take in are used to construct all the different parts of your body, but when they reach their shelf life, they're actually broken down and completely recycled to be reused again. An easy example are your red blood cells, the cells that carry oxygen, keep you from being anemic. The oldest cells in your body to carry oxygen, the red cells, are 120 days old. After that, they head to the recycling center, get broken down and recycled to make new red blood cells. All substances in the body undergo a very similar recycling. They're constructed, they're broken down. So in other words, everything's biodegradable. Now, in order for things to be biodegradable, you have to have assembly and you have to have the tools to disassemble it. So let's just say everything's assembled with a 1/2-inch nut and a 1/2-inch screw, and you've got a 1/2-inch wrench to disassemble it and break it down. But when amyloid develops, the amyloid protein, once it's assembled, things change and your body can't break it down. So you may have assembled it and you have your 1/2-inch screw and your 1/2-inch nut. Unfortunately, your tool is a 3/4-inch wrench and you can't disassemble it. And when that happens, that amyloid protein builds up in your body and your body is unable to break it down. And so it begins to accumulate. And once it accumulates, it starts to deposit in your tissues, heart, kidney, liver, nerve, causing those organs to malfunction. So the whole principle of amyloid is a non-biodegradable, non-recyclable protein. But this protein is not a dietary protein. This isn't what you eat. You can't impact amyloidosis based on your dietary intake. Where does this protein come from? Well, this protein actually is derived from your bone marrow. And your bone marrow is where all your blood is made. And to conceptualize this, you have to visualize your bone marrow as a garden. It's a large garden that produces 3 main crops: the red blood cells that carry oxygen, and if you don't have enough, you're anemic; the white blood cells, which are infection fighting; and the platelets, which are the cells that clot the blood. And those 3 crops in the garden actually constitute 90% of the garden acreage. 10% of the garden acreage is given over to boutique crops. 1% of the acreage of every adult's garden are cells called plasma cells. And plasma cells make proteins. And it's the plasma cells that actually make the proteins that in amyloid patients become the non-biodegradable, non-recyclable proteins that build up in the body. So the fundamental problem is in the bone marrow garden, where you have plasma cells making abnormal protein, but it's not just the plasma cells making the protein. The number is important. In a normal adult, 1% of the acreage is given over to plasma cells. But in amyloid patients, those cells begin to overgrow the garden. They increase in number. The number is highly variable. Some people, it's 5% of acreage, some 10%, some 40% of the acreage. And the easiest way to conceptualize the growth of these unwanted cells in the bone marrow garden is to think about them as weeds. These are unwanted. They're not doing what they're supposed to. And so their presence is highly undesirable, definitely unwanted. And so the easiest way to think about it is the overgrowth of these plasma cell weeds within the bone marrow garden, making the non-biodegradable, non-recyclable amyloid protein. And in fact, all of the therapies that we utilize in the management of this immunoglobulin light chain amyloid, AL amyloid, primary amyloid, is some combination of chemotherapy agents, which are you best consider now as weed killers, and that these weed killers, usually given 3 or 4 at a time in regulated doses, are applied to the garden, designed to kill the weeds that are responsible for the production of the non-biodegradable amyloid protein. And the reason you see a specialist to manage this is you need the right types of weed killer. You need the right dosing of the weed killer, because if you give too much weed killer, you are going to damage your healthy garden, and you don't want to damage your healthy garden. And then how often am I going to apply the weed killer? Is the weed killer given as a pill, a shot, an intravenous? All of these are the technical issues why you see a specialist who's skilled at the administration of weed killer, which of course we're talking about chemotherapy and immunotherapy to destroy the weeds in the garden. Typically, we'll use 4 weed killers today. That can be variable depending on what organs are affected, how severely they're affected, and whether there's significant health issues that are accompanying. But typically 4, 2 pills, 2 shots, starting weekly, often going to monthly. That can be worked out and does need to be individualized for a given patient, not a one-size-fits-all, not a cookbook approach. It does take experience to understand what are effective doses of weed killer, because everyone can't tolerate the same dose. The dose for a 35-year-old and a 75-year-old may not be the same. The frequency may not be the same, but the principle of weed killer to kill the weeds in the garden is the same. For a selected minority of patients, particularly younger patients, the goal really is to get rid of all of the weeds in the garden, get rid of them completely so they're no longer measurable and they don't make that non-biodegradable, non-recyclable protein so your organs can heal themselves. Not everybody gets complete destruction of all the weeds. In some people, you don't need destruction of all the weeds. In some people, you'll use a different combination of weed killers. But there's one specialized technique simply to be aware of, one in which you use a massive dose of weed killer. The goal is to completely destroy the garden in its entirety. Of course, if that's all you do is just kill the garden, the outcome will be very bad. You need a garden to survive, because the garden's making your blood clotting cells, your infection fighting cells, and the cells that carry oxygen and give energy to your body. So clearly just killing off the garden is not a solution, but we have a workaround. What we'll do, in not the majority of patients, a small number, is we'll actually go into the garden and we will collect seeds and we'll freeze those seeds. Now, they are garden seeds, but technically when doctors talk to each other, we like to use fancy terms, so we call those seeds stem cells. After the stem cells, the seeds are frozen in the freezer, we can actually go and apply a very high dose of weed killer designed to irreversibly kill the garden. And once that's done, we can go to the freezer, thaw the seeds, take the seeds and replant the garden from scratch and regrow it. And taking the seeds from the freezer and replanting the garden is transplanting the seeds, or transplanting the stem cells, which is how we get the terminology stem cell transplantation. Our goal, it's not a cure, but our goal is to regrow the garden without those pesky weeds present. So I'm going to summarize. To help understand what your doctors are doing is they're applying weed killers to get rid of the amyloid-producing weeds from your bone marrow garden so that it stops making the non-biodegradable, non-recyclable protein that your body simply can no longer disassemble and break down, leading to its depositing in the heart, kidney, liver, and nerve, resulting in the clinical manifestations that you're recognizing as amyloidosis, fatigue, shortness of breath, fluid retention, numbness in your feet. I'll be connecting over the next couple sessions to talk about other aspects on the treatment of amyloidosis. But thank you so much for your attention.